My name is Dr. Alden Milam. I'm a spine surgeon at OrthoCarolina. I chose spine because of the complexity of the patients. It's not necessarily straightforward. There's often a puzzle that has to be figured out in terms of trying to figure out why a patient is having a problem. Sometimes it's related to the spinal cord, sometimes it's related to the nerves, and sometimes it's related to none of the above and something that's completely different, such as a medical diagnosis or even a neurological disorder.
The most important thing in providing patient care is making sure that you listen to your patients, making sure that you're getting all their questions answered, their needs are met. They are number one priority.
There's often issues with the amount of time a patient spends in the office, and for me personally, it's more important the time that I'm spending with the patient and trying to address the problem that's at hand. Unfortunately, probably more so for me than running on time, but I tend to take each patient for whatever amount of time they need for me to spend with them to make sure that they're properly taken care of.
I think that there is a very collegial environment. The doctors that I work for work together very well. As a physician assistant who works under the supervision of surgeons, I have never felt that I did not have quality supervision and people that I could go to with problems.
I started having symptoms where I was having this tingling feeling through both my arms. I found out that I was having nerve damage in my neck. Finally came across Dr. Milam, and that's where we identified the problem.
Scott is a patient. He's an athlete. He enjoys biking. He's a triathlete. He had a problem that involved multiple levels of his spine that traditionally would have been treated with a fusion operation. Again, because of him being an athlete, I really wanted to try to maintain his normal mechanics of his spine. This was an operation that allowed us to decompress his nerves in his spinal cord without putting any undue stress on the remaining portions of his spine.
Through the whole process, he made me very knowledgeable of what the procedure was going to be, the effects that it was going to have on me long term.
The name doctor comes from a Latin teacher, and I think if we're not teaching our patients about their conditions and how to take care of themselves, we're really not doing what it is that we were basically destined to do based on our names as doctors. The most rewarding part of my job is basically seeing a patient who was in pain before surgery, and then you do an operation on them and you see them walk into your office basically having no pain at all or very little pain, or taking a patient who had spinal cord injury or some other type of injury to their spine where they were becoming paralyzed or developing weakness, having difficulty walking, and then yet again getting to see that patient truly walk into your office when they couldn't do that before. I mean, that is truly an amazing transformation that we have the opportunity to partake in.
When they come in and they know you right off, they call, they know your voice without you even telling them, that says a lot.
Dr. Milam, I just want to say thanks for taking care of me. You made it very easy for me, and I hope I never have to go through anything like this again. You never wish that on anybody, but if I do, I know who I'm going to come see.